Jill, I found my notes.
You found my notes or yours?
My notes.
Well, your notes are yours.
I'm going to talk about congressional advocacy and what NEA-BPD has done so far. And as you can tell from what Dr. Party said, that this is really an important thing for advancing the BPD agenda. So I guess it happened in 2007 when a friend of ours who's associated with our organization decided, she runs a support group down in Washington, D.C., and she decided to investigate how much funding there is for BPD compared to the other psychiatric disorders. So she approached the National Institute of Mental Health, or NIMH, and asked and got a report back that stated in 2008, NIMH spent $300 million on schizophrenia, $100 million on bipolar, and $6 million on BPD. And given the fact that a report came out just recently from another governmental agency, the NIAA, there is something like 5.9 prevalence of BPD in the community, lifetime prevalence, versus schizophrenia or bipolar, which is 1 to 2%. So you can see the huge discrepancy between spending. So we took it upon ourselves to start a congressional advocacy program. And we found that we wanted to increase awareness in Congress as well as eventually increasing funding. And the reason why research is so important, and research is at my heart because I've been a researcher for 20 years, it's a way of reducing pain of people that have BPD, and without research you're not going to get there. You're not going to really help people and move the agenda forward. So, for example, some things that can be done with research are investigating biological markers for people with BPD so they can be determined individuals that are susceptible at an early age. For example, for my daughter, had we known like at 8 or 9 or 10 that she was susceptible to this disorder, steps could have been taken. So that's huge. It would reduce a lot of pain in her life. Another thing is that with treatments, many treatments are beneficial, and looking at the biological and the psychological underpinnings of these treatments, and then deciding what to expand upon, what to improve. And then one of the last things is finding a single medication that would work for BPD. It exists in other disorders, but for BPD patients, they take multiple medications many times, and they end up with being obese and other medical conditions, and constantly changing medications too, which just so disrupts their lives. So those are some of the things that research can do. So we started our effort in 2007, and we had a congressional luncheon briefing on Capitol Hill on May 2007, and we had lots of people attending it. We sent out notices to all the congressional offices. We actually had it in the Capitol itself, and we had a professional speak. Stacy spoke as a mother, and we also had an individual with BPD who spoke, who ironically had worked on Capitol Hill when she was much younger. And then after that, the big thing was what we did with the help of Representative Tom Davis, who's now retired. He's a Republican from Virginia, but he spearheaded our efforts along with Chris Van Hollen and Nita Lowy. They were both wonderful. We were able, along with them and NAMI, to pass a House resolution declaring May as Borderline Personality Disorder Month, and that was passed 4-14-0, was it? Unanimously passed, and you know, it was just wonderful. But since I don't have my glasses on and Jim does, I know he could read the last 2 sentences, and I have to say Jim was magnificent. He was just spearheaded this event and was wonderful. Could you read the last 2 paragraphs? Yes. Right. And this is of the House resolution.
Whereas it is essential to increase awareness of BPD among people suffering from this disorder, their families, mental health professionals, and the general public by promoting education, research, funding, early detection, and effective treatments. And whereas the National Education Alliance for Borderline Personality Disorder and the National Alliance on Mental Illness have requested that Congress designate May as Borderline Personality Disorder Awareness Month as a means of educating our nation about this disorder, the needs of those suffering from it, and its consequences.
So currently, we're working on something, and I always get confused, Jim knows this better, the appropriations report language for the FY 2010 appropriations, House Appropriations Report bill. Right. And so it looks very promising, and her party was involved in it and sending a letter to NIMH and asking for a report plan on BBD, currently what they're doing and what they're doing in the future, and the same thing was sent to SAMHSA, Substance Abuse Mental Health Service Administration, lots of acronyms. And so, and another thing that we're planning is another luncheon, congressional luncheon in May, since in the House, since May is BBD Awareness Month. So thank you all.